this morning, our core conversation, menstrual hygiene management. It is abbreviated as MHM, and UNICEF actually defines MHM as using a safe material to absorb or collect menstrual blood, which can be changed in privacy as soon as necessary for the duration of menstruation. And it also includes using soap and water for washing the body as required and having access to facilities to dispose of or wash used menstrual management materials. Now, this is of utmost importance because management or other menstrual hygiene management and sexual reproductive health are very correlated. And of course, the ripple effects of the same, we shall be talking about more of that. And to help me have this conversation this morning, next to me is Dr. Nelly Bosire. She is a gynecologist. Thank you for making time. Next to her is Kennedy Ombema. Feels strange to call you that. So, AKA King Kaka, thank you for making time today. He's not here as a music artist. He's actually here as a menstrual hygiene management ambassador. Thank you for your time. And next to him is Dorothy Otieno, who is also an MHM champion. Asante for coming through. Now, it's interesting, and I think most people would wonder why we would have a guy in such a panel. Yeah, but I know this is something that's very close to you, Kaka. Probably you can tell us why it is that you decided to go into this, onto this path.
I was fortunate enough to work with UNICEF. I've been working with them now. We're going to the third year. And I stumbled onto this path, this innovation path, and I discovered a girl in Lodwar because we went there with UNICEF to open water points. Then I encountered a lady who was supposed to be attending school with this modern day time. She was secluded in a hut and sitting on sand. Oh, yeah. Which really got to me. So when I came back to the city, I said, I have influence, what can I do? So together with my team, we started with a primary school here in Machakos. What I'm learning is we're almost a year into my project, the King Kaka Sanitary Bank campaign, and we've benefited 10,700 girls. Yeah. And it's a shame, basically, the fact that I learned about this like a year ago. But since I've been highlighting this issue in this public domain through my social media and the interviews that I do, so many people now are getting the interest, which is good. And the fact that I'm also a man and talking about it, I'm not ashamed. Yeah. Because I feel this is basic. It's a basic need that not only the government needs to address. Let's not wait for the government, that's what I said. Yeah. Because the government work on so much going on. If you have the power and ability to start, you start. Do something in your little corner. Learn along the way. Yeah. All right. Okay. For you, Dorothy, you are part and parcel of the machinani. You've gone there. What he's saying, I'm sure you know you've seen even worse, situations. Tell me, why is it that so many years into modernity, we are still struggling with the menstrual hygiene management?
Thank you, Gladys. I think we've not prioritized mental health as a core function of being a human being. For me, a woman is defined by her wholeness. The full wholeness of a woman is her sexuality. And there is no way you can differentiate sexual reproductive health from a woman. And that is where the menstrual health comes in. Because for you to give birth, it has to start from somewhere, from the menstrual health. And so the fact that we've not given it a priority subject us to vulnerability, especially for the people who can't access information and who are in the interior areas, the remote areas, just like King Kaka has mentioned, because some of us are privileged to get the information. But then how about those who are in the grassroots, the mashinani? Personally, I was born and bred in Korogosho, the informal settlement, and it was difficult. Beyond the many psychological issues that we were struggling with, mental issue was one face, that period of time that we had to really struggle about. And for us, because we couldn't sit on the sand, we would use socks. sad to say, I used socks because my parents could not afford sanitary pads, and that was a leisure topic to discuss by that time, because the main focus was on providing food, the basic needs, food, because even rent had to come by. Yeah, so I think it's an issue that we need to prioritize as a nation. We need to prioritize issues of menstrual health.
Okay, now, Daktari, you're a gynecologist. You've been dealing with this for a long time, and as they're saying, we haven't prioritized. But then again, how do we prioritize something we don't even, or we're not comfortable talking about?
Absolutely. I think you just hit the nail on the head. The discussion must start there. Why are we not talking about menstrual hygiene? Why are we not talking about menstrual health? We talk about TB, malaria. We had issues starting to address HIV, but now it's common speak. If you talk to a 3-4 kids who are already starting school, they have some basic information about HIV. But when it comes to reproductive health, it's been a hush-hush thing. And partly it's cultural in the way we have been raised, but we're working so hard to do away with negative cultures, and this is one of them, and we don't feel like we've put enough effort. Case in point, look at how we're handling sexual and reproductive health education in school. We're having so much conflict about the content, and yet as we refuse to address it formally as parents, as teachers, as a society, the children are learning anyway online. So we need to get to a space where we need to understand this is part of health. It's part of good health. Okay, it's normal for a woman to have periods, and the girl growing up needs to understand this and know that it's going to come, in to anticipate it and how to manage it. It is important for the men in our lives to know that. Look at, our lifestyles are changing. Fathers are raising daughters on their own. So if we're not drawing them into these conversations, who is going to talk to their children about this? It's not a luxury, it's not a privilege, it is a right that every child, every girl, every woman should have access to information, and we should be able to talk about this as freely as we're talking about every other aspect of our lives. Once we're able to break that, then we are going to start having the conversations that matter. How do we access this? When we talk about, for instance, access to free education, access to free maternity, how is a woman supposed to access free maternity, but we're not looking at her at the whole spectrum of reproductive health? So menstrual hygiene is part of that. And we have to then have a way of incorporating it into the women's lives in the most accessible way, in the most sustainable way, and stop looking at it as a privilege. It's not a privilege.
Now let's talk about the myths and misconceptions, and I like the fact that King Kaka mentioned the fact that he got to know some of these things a year ago, so he's learning as he goes along the way. So let's think about this. You were in school, so probably the last time you had about menstrual health was in your biology class, right?
Yeah.
Okay.
Sadly.
Yeah.
Sadly.
But you lived and grew up with girls around you. What do you think is the biggest impediment of guys getting to know what it is that's going on with the girls around them, or just fathers getting to understand what's going on with their wives or their girls or daughters in their homes, or their homes rather?
I think just the way she has mentioned, we're not talking about this issue freely. There are areas we've been to just to engage the community leaders, and they would never even give us an audience. They're like, no, this is on a men issue. Yeah, take it somewhere else. And it's sad because at the end of the day, when they go back home, it's their wives and their daughters will cook for them. They're forgetting that this issue is, there's no man issue and a women issue, it's our issue, right? And if the women or the ladies' mind is not stable, which now means even the home will not be stable. There are so many interconnections that arise from the menstrual hygiene talk. So I believe that we need to introduce this formally and informally, with all the aspects, with all the platforms that we have.
I like the fact that you brought that up. You're a guy, King Kaka, you've grown up from a humble background. You know how Asiwamta talk, you know, and how they think. So how would you talk to them for them to understand the importance of working with the women in their lives?
I think it's communication, right? It's just communication. It's how do you deliver the message. Let me give you a case study. Let's say you're in class as a teacher, but then you get the levels, there are different levels on how students understand, right? And the teacher knows, kabisa, anajuanga that kid is sharp. The moment I teach hapo kwa blackboard anashika. And then I have a slow kid, slightly slow kid, but akipewa chance, there's a way I will teach them washike. So even the communication aspect of both students are different. And that's what we shall now go back to the drawing board and incorporate. Tuseme kama tunafanya campaign Islando, we need to get their language, right? Kwa sababu when we're doing a campaign in Karen, when you're doing a campaign in Kitale, we need to, do we incorporate the traditional language?
Yeah.
Where do they hang out after school? Do we need to go and have community leaders talk to them? Wanasikiza nani zaidi, right? Do they hang out shopping center, wakienda kucheki ball? Do we do adverts before soccer? Do we do community talks? Do we do competitions around that? So I believe there's so much that needs to be done. Mini boy, I was raised Islando, and we are 3 boys at home. No sister, no girl. And my mom never talked to us, and najua she's watching. Never talked to us about this. Alikuwa najua tutailan shule.
Okay.
Yeah, when I get so, if now we were made aware, for example, my program, when we go to schools, in the beginning, we were separating the girls and the boys.
Yes, when it came to that conversation.
In the beginning. Then we decided, we noticed that, since I'm doing it and I'm a guy, why are we separating the girls and the boys?
Yeah.
Let's start the conversation now with everyone here. And so we did that. Then the sensitive parts, now we separated, and then we let the boys know that, listen, this is your sister. Whenever this happens, be there for her. Take her to the school administration. Because everyone has a role to play. That's how I look at it.
A very good way of putting it across. Now, for you, Dorothy, even as you're doing your campaigns in the grassroots, Daktari here mentioned the fact that we need to be very open about the conversations, and even in the house, the conversation between a mother and daughter needs to be very clear, so that the daughter knows what she's getting herself into. How does that look like in the grassroots, and where are the gaps?
Yeah, like I mentioned, it's still a challenge in the grassroots, where our parents are still preoccupied with the basics. They have to wake up very early in the morning and come back very late at night. And so even that relationship between mother and daughter is nowhere. A case in example, I can't recall any time I sat with my mother discussing menstrual health. I'm not sure, because she never even bought me a sanitary pad to this level. Because I understand, today I understand, but at that time I couldn't understand.
Yes.
Yeah, because they're preoccupied with so much. They are struggling. It's a chase society. They want to see that you have food on your table. They want to see that you're not locked out from the house. And so in most cases, people in the community tend to get information from third parties. And I think that is where we're getting the disconnect, because what is coming up from the third party is not, might not be the correct information. And I think it is time when we now change the paradigm shift, because parenting, again, you cannot differentiate parenting from the wholesomeness of providing for me food if you're not concerned about my well-being. And so we are trying to tell parents to spare some time to connect with their children, that bit of connection. Even teachers, you find that in school, a girl is more, for me, I'm usually more connected to the boys. I don't know why. I was brought up a tomboy. So it's easier for me to talk to boys, because we have that mentality of masengenyo, which is also an issue, because I will open up to you. The other side, it will be stories. You know, Nani's, she's going through this. But with boys, they know how to package it and give you that an assurance. And that's why I like the idea of bringing boys into this discussion and being part and parcel of it, that they can stand with me as a sister. They can be there to hold me when I feel low. Because in school, they used to laugh at us. I went to a school where we will share a desk, so the girl will sit in the middle. So you can imagine, you've stained yourself. That day you will not go for break.
Yes.
And at some point you'll be forced to tie a sweater on your, and the teacher will have an issue with you. So you go to the toilet, and sometimes you will not come back to the class. Your day is messed up for the day. And so I think this conversation needs to be as open as possible. We need to package it in a better way. And so I use my example, because I tell them, those times, the sanitary pads was something we would hear. in my community at the grassroots level. It was not available like it is today.
Yeah.
And we could not even afford it in the first place. So why would we even care about it? We knew it was for specific people.
Yeah.
So for us, it was tupambane na hali yetu, I will say.
I hear you. Now, Daktari, this natural flow of life is such a great impediment to girls' education, because when you have that to deal with, it hits on your self-esteem, and you stay away from school up until you're done with this, and now come back to the usual, because you don't even want people to know you're going through the same. So even as a parent is hassling, the ripple effect is, if you don't take care of this, the girl will fall off school, and the money will not even help her at the end of the day, right?
That's very, very true.
Okay, so how do we ensure that these girls, because retention in school is of paramount importance?
I know, I like the stories they're saying. They're so real, you know, like they're so relatable to all the girls that we deal with, that we meet. And you know, we're like, if this problem is such, it's in our faces, how are we not holding it by the horns and just run with it, you know? Like, there's something she's mentioned that you would actually be embarrassed about it. Why should a girl be embarrassed because she stained her dress? I mean, if you spilt a cup of tea on yourself, are you embarrassed about it? You'd be uncomfortable, like, oh gosh, I messed up my outfit, but you're not embarrassed. So we haven't reached that stage. We need to reach that stage that a boy can actually tell a girl, oops, sorry, you seem to have an oops moment on your dress. Why don't you clean it up? But not to make the girl feel embarrassed. It's just, I pointed it out, but that's about it. We haven't gotten there because we are not having these important conversations. And the other thing that is so real that she talked about is talking about pads being seen as accessible to the elite.
Yeah.
This is a basic need. A pad is a basic need. There is nothing elite about a pad. I like the fact that now we are trying to make it cheap. The government, 2011, went out of its way to slash taxes on sanitary towels. That was a huge step. It allowed these towels to come down to as cheap as 50 bob a packet. So if a child needs 50 shillings from a parent once a month, like, we must actually realize that that 50 shillings must be a priority that must be budgeted for in the household. Okay? The government has done its job. The Ministry of Health has, of course, had this provision of sanitary towels to the school-going children. It's a noble initiative. I know UNICEF is on it. There's so many organizations that are working to achieve the same. But one, we need some unified purpose. We need to actually see these pads on the ground. We're having a challenge where you go to a school that you expect that this should be here for, children should be having 12 packs a month, and you find they're getting 3. For instance, there are challenges that are also inherent within the program as much as you try. You go to a community. Ms. talked about the very hard to reach areas. So these children in school are given pads, and they're given a stock, let's say, for the next 3 months. And she'll take her 3 packs at home, but her mom will have her period. Is she going to say no to her mom? That, like, mom, this is mine, you deal with your condition, we'll figure, you know, or find out a solution for yourself. So she's obligated to share, and then when it is time for her to actually have the period, she doesn't have any to use. So we have to look at this wholesomely. Like, when we're talking about, it's like when we talk about school feeding programs, we feed the children in school, which is important for their nutrition, but we need to figure out how is it sustainable through the house. So if you're going to give pads to school-going children, and this child is coming from a community where the mother cannot afford to buy for her. If she can't afford to buy for her daughter, she absolutely can't afford to buy for herself. So the mother should also be taken care of, so that there's a proper, wholesome you know, care for all of them, for this to actually be availed.
Okay, so for you, King Kaka, with your sanitary bank campaign, are you considering these things? Because she raises a very fundamental point. There is a mother at home. There is no way the daughter will use it, and she doesn't use it. So what do we do to make sure that we sustain this?
For sustainability purposes, I think we had that challenge in the beginning, because most parents that we talked to, because my program is deep in the rural, where we go to most girls and they tell us we've never seen a pad before. We went to a certain school in Kitale, they don't have shoes. You don't expect them to and then half of the school, they had like half sweaters. So I asked, what's really going on? And it was the rainy season. And they were telling us that's what we use, sanitary towels. Because our parents, and the parents were plain blank. They told us, listen, It's either we buy food or we buy those things.
Yes.
And the moment you tell your daughter that, anaanza seek other alternatives.
Yeah.
And we've come across so many other problems that are interconnected to just the sanitary towel, which is now a point of conversation.
Yes.
For us, we realize, wow, this is just a point of conversation. So we need to go back now to the society and ask ourselves, how do we create employment, self-awareness, and empower the community to the level that now the mother can afford this affordable sanitary towel. Because now even if we give for how long? Because the government, I applaud the government, it's doing a really good job to fight this. But we've been to schools that the distribution has not been that effective, right? I mean, they have so much to deal with. So how do we make this sustainable? And the fight has to be for sustainability purposes. There's also that economic empowerment.
Yes.
To make them afford this. So make it affordable. If it's affordable, where's the money to buy it? Yeah, so even most parents don't have a job.
True. True. Dorothy, in
Yes.
the grassroots, let's be very honest. And
Yes.
this is not even a grassroots affair. It's everybody
It's
is hustling
everybody.
to
Yeah.
make a
Yeah.
living. Yeah. So if you can save some money on some areas of your life, you will save up on the same.
Yes.
So let's talk about alternative ways of dealing with menstruation. Apart from the pads, we have washable pads for those that cannot afford to have that regular income. And we also have something else called a menstrual cup. How is that being taken up?
Like I said, this is an area that needs a lot of advocacy and even awareness creation. In my community, I don't think the issue of cups, they even understand what it is all about. Even tampons, yeah? So we have so many alternatives, but the information is not reaching at the grassroots level. For us, you get a pad, that is it. And it is saddening that even the pads that we are getting it at the point of charity, not as a need. Yeah, it's not like you're not entitled to it, because the people who are coming to give pads, sometimes we go there as a charity, as giving back to the community, that angle, because it's something scarce, yeah? And that is why we have had issues of low quality pads, because it's just for that time, and then the next time you just take care of yourself.
Sounds like a by the way.
It's a by the way.
Yet
So
it's
all these, we have so many, I would say, products dealing with menstrual health,
Yes.
but the sensitization in the community, the awareness, or those options are not fully there. Currently, people are using traditional means. Last time, I'm a heavy flower, so when I went to the supermarket, there was a time there were no tampons in the supermarket.
Yes.
And so I went there and I was like, now I'm done. Because for me, I have to use a tampon and a sanitary towel.
Yes.
Yeah, underneath, so that I don't stain myself. The first 3 days is usually a mess. So just to precaution myself, I have to use a tampon and a pad. So I was like, now my week will be messed up. And this lady was advising me, why don't you use the traditional herbs, you know? So there are those who use traditional herbs. I've never tried. But
Which ones are these? Please educate us.
maybe Daktari can help us, because I was like, we have herbs that can, because she was like, it will control the flow. I didn't see the medicinal bit of it. Yeah, because I'm not a doctor. Yeah, but people are dealing with the issues depending with the circumstance.
True.
That is
Daktari,
what-
please. Educators, menstrual cup. I remember this was launched to help those that cannot afford. It was an alternative method depending if you react to some of these sanitary towels. How is that being taken up, and what exactly does a menstrual cup do, and how does it work?
Well, first we have a few challenges. A lot of the alternative products that can be used for menstrual health have actually not been approved by KEBS for use, and that's why you don't see them in the supermarkets. So these are not even available. So a lot of people who have to use them purchase them online, you know, it's a one-on-one sale, and that is not helping to create awareness that these products exist. The same with reusable sanitary towels. So there is an issue of how do we put standards for this, which I think is a conversation that's a non-issue. It needs to be dealt with. We need to figure out what we need to do to put standards and avail these products on sale. If you can put standards for an underwear, you can put standards for a reusable towel. So move on. Let's move this conversation along. Once we have these products available, then we can talk about awareness, okay? But you know, we have to also look at different populations. If I were to take a reusable towel to a child in Garissa, how is she going to wash it? And water is an issue for every other, you know. For her, the option will still remain a disposable sanitary towel. When we're talking about menstrual cups, yes, fantastic, you can have one and you'll use it for even up to 10 years, okay? But the challenge is that at the outset, it costs a lot of money. At the very bare minimum currently, it's about 2,000 shillings. And some of these prices are that high for the simple reason there is no effective competition because these products have not been licensed to be put on the shelves.
Okay, let me understand. One
Yes.
menstrual cup
Yes.
costs you 2,000 shillings.
Yes.
Which now removes
The cost for the next many years.
Yes.
But the cost is then how do you see it works for organizations, for instance, like his that know if I invest 2,000 shillings in a girl, she's done for her period of schooling and college, and by the time she needs to get another one, she can afford to get it for herself.
Are we saying that you use one cup a day?
No, you use the same one. Once it's full, you take it out, you wash it, and you reuse it.
You reuse it.
Absolutely.
I love the fact that he knows this more than I do. This is very refreshing.
When I started my campaign,
Yeah.
I was introduced to the menstrual cup, and I was like, "Yay!
You know?
I have a 10-year solution."
Yeah.
But then when I went to the grassroots and the rural areas, the community leaders were against it.
Yeah.
Absolutely.
Because the fact that I'm dealing with, because my program starts from primary school when the girls are just discovering themselves.
Yes.
And now we are telling them, here's a
To
cup,
discover
you can
further.
insert.
Yes. Oh.
Yo, that's an issue now.
Yeah.
See, an
You
issue.
see so many issues now.
Yeah.
I was like, you're now back to just
Going, exactly. The
taboos.
same issue, this
Wow.
debunking
Yes.
these myths.
Yes. Yeah.
You cannot talk to a girl about menstrual hygiene without allowing her to explore and understand her body.
Yes.
Yes.
You cannot take care of your menstrual health without touching yourself. So if a girl doesn't know where a tampon is supposed to go, how is she supposed to use it? Okay, and if the girl can use a tampon, obviously she can use a cup. So these are things that, as I said, as long as we're not having these candid conversations, then we're not making headway with menstrual hygiene. So we do have to break the silence, and we have to create a generation of young people who are happy to talk about their menstrual health so that they can carry it on to the next generation. Our parents and our elders might be too old to convert them at this age, but let's talk to our young girls so that they don't have to fear to have these discussions. By the time they have daughters, they can talk to them freely. Let's talk to our boys so that when they become fathers, when they start dating, it is a bit pretentious for a man to refuse to talk about menstrual health, but he's going to tell you that things can't happen in my bedroom tonight because my wife is on that time. So they are aware.
Yeah.
So what they need to do is be aware in addition to how to help them live through this.
Clearly, men are stakeholders in this.
Absolutely,
At the end of the day,
yes.
we cannot ignore this. Yeah.
Yes.
All right. When we come back from this break, we'll talk more about how the connection with water and sanitation is very important, because at the end of the day, when you're talking about menstrual hygiene management, it means we also need to manage it in a clean way. Right after this break. Morning, we're talking about management, or rather menstrual health management. This is a conversation that most would rather not have, many shy away from, including parents to children, teachers to children, yet it is something that is a monthly occurrence and it's something that you cannot control. So hey, it's about time we actually took time to talk about it and talk about solutions on how to ensure that everyone has a basic needs to ensure they go through this period in a dignified way. Still with me, I have Daktari, that is Nelly Bosiri, I have King Kaka, and of course Dorothy. And before we went to break, King Kaka, you'd mentioned that there's a time you'd gone to, was it Turkana? And you were setting up water tanks?
Water points.
Yeah, water.
UNICEF, yeah.
Okay, and this definitely is very much related to menstrual hygiene.
Very.
Speak on the same.
There's that, the MHM actually basically is, because health is important, right? The reason even why the government has not given a KEBS sticker to the rewashable ones is because most societies or most
All right, before I cut off King Kaka, we were talking about the relation between MHM and water and sanitation.
So basically, water is involved in all the aspects of using sanitary towels. If you're using what normally the urban or the elite are using, you need water.
Yes.
If you're using the menstrual cup, the instructions are you need water. If you're using the washable ones,
Yes.
wash. You need water.
You need water.
Yeah. So then, even during my campaign, we've noticed that now we need to start conversation around how do we get water to those areas. For example, while we were in Lodwar, like children would not go to school. They would walk like half a day to go and fetch water and come back. And now it means they can't carry a whole load of water. They would carry only the ones that will help them cook, or maybe wash their clothes. So water is an issue that needs to be addressed in the same level with menstrual health management.
Okay.
Yeah.
All right. And in the grassroots, sanitation, again, is another connector to all this, because the disposing of these pads, whichever you're using, and also, as he said, the cleaning of the same. How does it look for you as you go to the grassroots?
I think this is a major issue, not only in the grassroots.
Yes.
Apparently, sadly, even in workplaces, whereby in the community, most of the lavatories are the pit latrines. So it's, use it, dip it inside. So, and even the way we empty, the pit latrine is so despicable. Sorry to say, we use it in the most manual way. There are no exhausters that we see around. So we have these mkokoteni people who will come to dispose. So it's actually very unhygienic. We've had workplaces where there are no, what do we call them? The bins.
Yes.
So what do you do? So you will fold your used item and probably put it in your bag. And that makes it very much uncomfortable. Water is still an issue, like you said, in the community, in Kibera, in Korogosho, most of the informal settlement, I know people are still buying water. It is not free. And you buy it for the necessary, items, I would say, like for cooking, it's a priority, for washing. So the issue of water, how then do we even tell people that you need to wash your hands after changing the pad? Because water is scarce in that area. And again, there is this perception of being dirty, when you're menstruating, you are dirty. And this perception is even in the church, where a woman is told you're dirty, you can't go to the pulpit when you're menstruating. So I don't know whether this dirt has been taken literally to mean that you can't, even the water bit of it is not there. So I think we cannot differentiate hygiene, menstrual hygiene, with water. It comes in as a package. Water and soap. Sometimes you just get water, but then the soap bit of it is still lacking.
It's still lacking. Okay, Daktari, even as we talk about disposable pads, we're talking about washable ones and the menstrual cup for those that can afford. As they're saying, if there's no water, it complicates the whole process. So even for policymakers going forward to help with this menstrual hygiene management conversation, what should be paramount?
Well, looking at it wholesomely, it means that because of the challenges of water in many places, then of course then the disposables become a more logical option, and that's probably why they are what we have seen in our society as most used. But it's important to also realize that we're also tackling with the environment, and so it's important to have proper disposable like policies around disposal of sanitary towels. So we're not doing enough. Okay, I would think that institutions should even have their own incinerators. But that's another challenge, that we still don't even have standards for incinerators, because we have to decide how much pollution they're causing to the air and all that. And we're taking too long to make very important decisions about matters that are already here with us. So we expect that these are things that must be handled. When she's talking about absence of water, it is a real factor. You go to the village, even the ones that I've tried, and they have hand washing points, the hand washing point is outside. So how is somebody who's using a menstrual cup going to leave the lavatory, go and wash their cup, and then come back? It's very complicated. So, you know, those are things that inform that, oh yeah, if we're going to push for the use of reusable items, if we're going to try and manage the waste in the environment, then we have to think about water points inside. And these come at a cost. So I like the fact that we're having these conversations again, because we're beginning to bring to the forefront what is critical, that other people will probably not think about, because we are not having the conversation around menstrual hygiene. So it is wholesome. There is need for access to all these things. And the other aspect that we really don't look out for is that when we don't talk about menstruation as a normal physiologic process, then we deny our girls an opportunity to understand when things are not right and to seek for medical help. Dorothy is a good example. Her periods are not normal. She's supposed to see a doctor. You see?
Dorothy.
So,
There we go.
and have this managed,
Yes.
you see, and there is proper medical management based on why does she have heavy periods. So if you don't talk to your daughter about periods, how will she know what's not normal? How will she know that the pain I feel is out of order and actually requires medical attention? So it doesn't just end at hygiene, it also has an impact on health.
True.
Okay, but I think I would also like to be very cautionary that we talk about it as menstrual hygiene management. It is not exclusively a health issue. I wouldn't want to medicalize menstruation, because the moment we do that, then we create even more barriers to access. Okay, so where we're sitting, for instance, our Ministry of Health has to come up with a policy on what to do with reusable menstrual hygiene products. But the reality is that it's a product you use. The same way we use lotion. We haven't medicalized body lotion or petroleum jelly or whatever you. It isn't going into your body. Yes, some people may have allergies. So do people have allergies to peanuts? And yet it is a food product that is very healthy actually for everybody else. So we need to be able to delink meats. We need to be able to make things very clear so that we don't create barriers for our people to access the sanitary towels. We need standards that are not going to be too difficult to achieve. Okay.
Very well said, and I'll consider those your parting remarks.
Yes.
King Kaka, because we need to wind up. The County First Ladies Association, along with Her Excellency, the First Lady of Kenya, Margaret Kenyatta, launched a 3-year menstrual health management program in 2018. Do you remember that? So that means all the 47 First Ladies are into this. In your campaigns, have you seen the ripple effect of this program, or is there more that needs to be done?
I think that's a good start. It's a good start.
Yeah.
It's a good point of conversation, because each and every county that we go to, we involve the county government as well. The First Ladies, we tell them, we're coming to visit your schools. There's a number of schools, so they give us guidance.
Okay.
But also my plea would be, as much as we have these sittings here and we do policies and we do meetings about, and we create these big documents, I've gone to meetings for all here, and I haven't seen most policies taken into action. I know they take time. People are excited to go for meetings and create policies, but we need now a point of action. When do we start? And I would challenge everyone who's watching. You don't need to be on an NTV interview.
Yes.
You have your social media platform. You have your neighbor. You have your daughter. You have your sister. If you're a mother, talk to your kids. It starts there. And then two, I realized something that I would like just to point it out there. The fact that these rural girls have created an innovative alternative ways of using the sanitary towels through the sweaters and the socks. There's an arise of UTIs and infections that these young girls are afraid to talk about. So you find that they have these diseases and they don't talk about them,
Yes.
and they're growing with them. So while we are doing policies and such interviews, let's encourage and create points where views and they can just go to the hospitals and get administered.
The points of contact are very important.
Yes.
Okay, very well said. Dorothy, as you're parting short, even as we continue talking about this and you being a champion, what would be your clarion call?
I think it is high time we have a concerted approach into this matter. I like the fact that Dr. has mentioned that we should not align it to medical a wing, because this is something that affects us, all of us. Yeah, we've had issues where politicians are saying that normally when they are campaigning, you know, we are empowering women to be leaders, but their sexuality is used to stain them. I remember Honorable Laboso mentioning about at some point someone had to stain her seat, you know, to kind of, you know, show that embarrass her, and I think we don't need to be embarrassed about our sexuality and about our menstrual health anymore. And again, I think it is a high time our girls embrace themselves and not shy away from, you know, feeling embarrassed. It is your well-being. It is you. It's normal. You. It is normal. Embrace it. Seek help. Don't keep quiet about it. Seek help. Come up with initiative. For me, I like the bit of sustainability. The sustainability of having the pads. I remember us coming up with emergency kit in our Form 2 class, where, you know, we will have just something on the side if you're in a bad situation, that you can actually go there and pick one. So let us come up with innovative ways of seeing how then do we handle this situation, even as we look into policies and the implementation, and also bringing on board the manufacturers, so that we don't necessarily look at, you know, selling the product, but again, a product that comes wholesomely in terms of educating and creating awareness for our girls.
And that is of good standard.
Yes.
All right. Thank you for that insightful conversation, Dr. Nelly Bosire, gynecologist. King Kaka, of course, he is a MHM ambassador, and Dorothy, who is a champion of the same. Thank you for your time. We've been talking about menstrual hygiene management, a very good conversation, one that needs to continue. And I see you speaking to us on our social media handles. Remember at NTV Kenya, @Gladys_Gashanja, and any of our panelists, you can reach out to them on the same. Let's get back to that conversation. World Health Day coming up on April 7th, and the theme this year is universal health coverage, everyone, everywhere. We do know that UHC is on its pilot project right here in the country, and this is something that has been taken in Kisumu, Nyeri, Isiolo, and Machakos counties. And today we take stock of how that looks like and how it's benefiting Kenyans. And to help me have that conversation is Professor Dominic Mwenja. He is the CEO, Mater Hospital, and Rajuma, Program Manager, HIV and TB from POS Kenya. Thank you, gentlemen, for your time. Now, earlier on, before we went to Awendo, there was a clip we were watching on Martin Juguna, who's been living with kidney disease. For 4 years, he has been on dialysis, and he's stuck on dialysis because he cannot afford to actually do a transplant. And we do know the aftercare is even more expensive. So in such a scenario, how is it that the universal healthcare coverage that we are putting across help Kenyans that cannot afford basic healthcare? We'll start with you, Professor.
Okay. Thank you. It's not easy for people like that young man. And at Mater and other hospitals, you see that all the time. The issue of affordability is a big problem across all types of diseases. With the universal healthcare, which I prefer to call affordable healthcare, because we might never achieve universal healthcare. Even advanced countries have not been able to achieve universal healthcare. This is affordable healthcare. We need to be able to make healthcare affordable to our people, so they have access to healthcare. And there are 6 tenets of health systems strengthening as WHO guidelines. One of them is service delivery. The other one is healthcare workforce. The other one is strategic information. The other one is health financing. The other one is leadership and governance. The other one is medical products, vaccines, and technology. When you put all those 6 things together, then you can be able to strengthen the healthcare system. In the absence of one of those 6, it becomes very difficult to deliver that healthcare. For us, it's mostly financing. And that's a problem this young man is facing. Now, with NHIF paying part of the transplant, the family probably doesn't have enough money to raise the rest of the money to go to India or to come to either Mata or Nairobi Hospital or the other places where we do transplants. So it becomes extremely difficult for them to be able to do that. And renal problems are a big problem in this country. There are dialysis centers all over the place. So we have to approach this from an ecosystem perspective. As we try to help the individuals, we also have to look at the health of the nation. Because we have an explosion of renal cases across the entire country. The same thing with cancer. We have an explosion of cancer across the country. And therefore, it has to be a holistic approach to how we, 1, educate our population to keep their kidneys healthy. 2, how those people who already have renal issues can be able to access healthcare. Someone like that young man, probably if he gets a donor, which is always sometimes a problem, and that's why we have also to educate our people that when you have a healthy kidney and you have 2 healthy ones, you can donate one to a brother or a sister or a relative.
Because you only need one.
You only need one to survive. And you can have a full life with just 1 kidney. But a lot of people are afraid of donating an organ, even if they have full life. So with this young man, I know dialysis sometimes takes a toll on your body. So he may have to, if he has already gotten somebody who can donate with NHIF, and you do transplants here locally. If then NHIF will cover part of it, then the other part will have to be covered probably through Harambe that he has to do. Well-wishers who will come and support the process. But for him, I think right now the most important thing would be to find a donor. If he finds a donor, and there's a match, and then the family can get together, and we can even come to the country and tell the people, just donate 5 shillings, 10 shillings each,
and help them
and we raise enough money for the young man to get a transplant.
Okay, Andrew, we are now talking about Harambes, which now points to the fact that there's a gap in the system in as far as accessing healthcare is concerned when it comes to financing. How can the universal health coverage in this case, or affordable care, as Professor is putting it, be packaged to ensure that those who have no dime to their name still can walk into a hospital and get all their needs met?
I think as Professor stated, it's a holistic approach. It's not something that can be done overnight, and it's not something that it's not an easy step, it's not an easy process. In terms of financing, I think as a country and as different actors, both government and non-state actors, we need to look at what are the effective models that we can put into place so that we do not have situations like this young man. If you look at all the data, you look at all the reports that are put forward, a health emergency is one of the quickest ways that a family that was surviving goes into extreme poverty. Because what if that young man cannot have a Harambe? What happens? That young man as is, I don't know his background, but maybe he was a very bright student. He was the next Nobel winner. He was the next great engineer. Who knows what he'd have done? But because of an ailment, his productivity is curtailed. And when we look at universal health coverage, I like to approach it from the lens of better health outcomes for all Kenyans, and better health outcomes leading to more productivity and a stronger nation. But we still need to look at the models, and that's working with non-governmental organizations like PS Kenya and seeing we as PS Kenya work through the private sector. What are we doing to shape and help the private sector, capacity build the private sector to be able to offer affordable quality services and greater service delivery, so that for the people who cannot access certain services from the public sector, there's the private sector there that's affordable and high quality that can support them. And also working with policymakers so we can combine what is happening in the private sector with what is happening in the public sector, so it's complementary. Because at the end of the day, it's all about the health of Kenyans.
Very well said. Now, Professor, even as he's talking about the private stakeholders, let's talk about insurance companies, yes? For the longest time, most Kenyans will tell you insurance companies feel like they can only be accessed by the upper crust. You know, they are not here to take care of me. So when I get myself into a bind in as far as my health is concerned, I do not have anyone to help me out, just my NHIF card if I have it. What can be done to ensure that even as we pursue UHC, that these private stakeholders can come in and help alleviate the expense that goes into healthcare?
Actually, as he was talking, I was jotting those three things down.
Yes.
And when it comes to financing, you have three actors. You have government, you have individuals, and you have the insurance. Among those three, we should be able to cover our healthcare expenses. The biggest problem we have in this country, we have probably before NHIF, we had a 3% penetration for insurance, especially healthcare. 97% of our people out there have no idea about how to get health coverage. And so that's a challenge we have to give to our insurance companies. The other day I had a conversation in my office with one of the large providers of health insurance in this country. And part of what we are looking at is we have all this population that is not covered. And this population don't have a lot of money that they can be able to pay 100,000 per year, 50,000 or 60,000 per year.
Yes.
But there should be a product that can address, that is structured to fit that population, which doesn't have that large income, that can be able to give them that safety net so that each family is not one illness away from bankruptcy. Each family is not one illness away from eating up the money they had set aside for the children to go to school and all those other things. Now, when the insurance companies now start to have products that address the poor, that address the lower income individuals, then we start to see the access of care becoming a reality. Because even with NHIF, they don't cover everything.
Yes.
Because I deal with them every day at the hospital. But it's been a great addition to the healthcare access to this country. And we have to commend the government for that in terms of NHIF. With NHIF now, a lot of people with the 500 shillings or so that they pay every single month, they can access some kind of care. But when it comes to specialized care, which is much more expensive, then the individual, the family, and the insurances now have to come in. So we have to challenge our insurance companies to not only focus on those individuals that can be able to afford several 100,000 or 50 or 60 or 70,000, 100 to 200,000 a year, to this other person who has a few hundred shillings every single month, so that some of these costs can be alleviated.
And we're pointing at the Kadogo economy, quote unquote, yes?
And from where I'm seated, I think it's also looking at what can we learn. I know Kenya, we are fond of benchmarking trips and they have a certain negative connotation towards them. But if we look critically, we are not the first country that has faced this challenge, and we will not be the last. What are other countries doing? For instance, I know when it comes to UHC, Thailand is held up as a great example, a shining beacon.
Yes.
What people forget is that it was a 30-year journey. But they decided to do it in a systematic manner. And when it comes to financing and making sure that more people have access to private health insurance, they adopted different models. I think there was a time where they looked at financing it from taxes. So they took a proportion of taxes and gave people private health insurance. This is what the government did. In Australia, it's even, right now, it's more simple. It's ingrained in the fabric of society, where if you're over the age of 30, earn over a certain amount of money per year, if you do not take private health insurance, you get taxed more. And why they do that is to alleviate the pressure from the public system. If you can pay for it, then you should pay for it. Now, I don't know what model will work in Kenya. Maybe it is trialing it out with 47 different counties. Maybe we can try it out. But I do think these are the conversations we need to start having now, as we're having this great look at getting universal health coverage to all Kenyans. Is how are we going to pay for it?
Fundamental question. Now, Professor, let's talk about priorities, because when it comes to us trying to establish universal health coverage, there seems to be some gaps in the system. For example, just having a conversation about the management of diabetes, you will hear that doctors will say it does not make sense that NHIF covers for dialysis, but it will not cover for the taxes or the cost of getting insulin. We do not have a priority here, because if we had insulin, we'd have less people getting kidney failure and going through dialysis. Professor, how can some of these things be put in place to ensure that we deal with preventative healthcare as opposed to curative?
Curative. Actually, that's exactly what I was thinking. Now, let me go back to something you just said about Thailand and other countries. If you look at the fundamental structure of our economy, you start to see where we are flawed. For the taxes, if you look at the countries that have succeeded in providing access of healthcare to their citizens, they're highly taxed. You go to Canada and other countries, they're highly taxed, but that tax goes directly towards funding specific programs. Now, when you come to this country, there are less than 4 million Kenyans who pay taxes. I don't know whether you knew that. Less than 4 million Kenyans who pay taxes. Now, and 53% of the money that we collect in this country goes to paying government workers. 53%. So we are left with 47%, which now we are saying we're going to finance the Big Four agenda. We're going to finance our defense. We're going to finance our security. We're going to finance development. We're going to finance the cost of the loans that we have borrowed from outside. So there are fundamental flaws in the structure of the economy itself in order for us to be able to address some of these bigger issues. And that's why a comprehensive review of how the structure of the economy is extremely important. And that's why I was happy when the current exercise of making sure we have less workers in government, the ghost workers and everybody else, the bloated bureaucracy
and the allowances being slashed,
and all that. Those are structural weaknesses that we need to start correcting now in order to free up now capital or cash that is going to finance some of these things. Now, when you come to preventative medicine, it's unfortunate that the insurances we wait for you to get sick to cost them more to prevent that disease from happening in the first place. We focus more on curative than preventative medicine. Let me tell you one thing we do at Mata. When you do the Mata Hatran every year, which is coming on May 25th this year, the money we collect goes towards funding cardiac surgeries for poor children in this country that cannot afford. That's when I was looking at this young man with the issue with renal. Program-specific programs helps to address some of the issues. Now, with the cardiac program that we have at the hospital, we are able to do more than 300 heart surgeries and other procedures every single year on poor children who have no money to do that. Otherwise, they'll be telling the same story that this young man is telling. But we also focus on preventative medicine as well. Because every year we go to, like this year we're going to 11 counties. And when we go to those 11 counties, we do medical camps and we educate people about the health of the heart and how to prevent children from having rheumatic heart disease, for example, which is very simple. And that's why we tell parents, when your child has a sore throat, make sure that sore throat is treated completely. And if you get antibiotics, make sure they finish the dosage and the child is okay. Otherwise, if you don't treat that child, what will happen is that infection will end up in the lungs, which will end up now in the heart. with a collapsed valve that we have to go and fix. Now, if we don't tell the parents what they need to do, then I'll be seeing those little kids 2 years, 4 years, 5 years, 6 years down the road. So we need to focus more on preventative care rather than curative care. And insurances need to come up. They need to fund the same. NHIF needs to fund the same. When it comes to issues now of insulin and all these other issues, those are things that we need a comprehensive look at some of these specific diseases.
Yes.
And there are 4 specific diseases in this country that are affecting a majority of our people. Renal is a problem. Cardiac is a problem. And then cancer is a big problem in this country. Others have to do with the environment and all the others. But if we are able to focus on those 3 or 4 major diseases that are affecting people, that are very costly to treat, then we can be able to start to see some impact in lessening both the number of people who go to that extent, like this young man,
Yes.
the number of people we have to be looking at to go to India, to go to other countries. And that way, the cost of financing healthcare also starts to shrink.
All right. Now, Andre, even as we wrap up this conversation, because we were just trying to figure out how we can ensure that UHC is a success in this country, we know that health is a devolved function. How can the counties take care of their own people and ensure these parameters we're talking about are actually established?
I think just to echo the point Professor made, there are some diseases and conditions that preventative care is definitely cheaper and leads to a better health outcome. For instance, tuberculosis, which is a new focus area for PS Kenya, a lot of people get a cough. They cough for 2 weeks, they get night sweats, they get fever, but they go over the counter. They get one pill. It doesn't work, they get a syrup and a pill. It doesn't work, they get a stronger pill. What they don't realize is if they just went and got screened for TB, and if it was confirmed, they started treatment, A, they don't infect more Kenyans. B, chances are they will be much healthier at the end of it, and they will not develop multi-drug resistant tuberculosis. Now, we had World TB Day, we celebrated it on the 22nd of March in Kiambu County.
Yes.
Kiambu County is launching the TB-free counties initiative, which is noble because a lot of people in Kiambu County work in the informal sector. They live in very densely populated areas, so their incidences of TB are much higher.
Yes.
And the county government has realized if we do not stop this now, if we do not get a handle on it now, it will cost us more. Why? More people are going to fall sick. We're going to lose productivity. The knock-on effect is out of that already tiny pool of 4 million taxpayers, it's going to reduce further. And that's why I keep saying health has a multiplier effect.
Yes.
If you look at the HIV situation in Kenya, amongst the youth, it is really bad. Almost over 50% of all new HIV infections are in people under the age of 35. As PS Kenya, what did we do? We launched the pilot program for self-test kits, which are now available in private pharmacies. And what we've seen from the data over 2 years is that 60% of the kits are going to men who are very hard to reach because men just do not like going to the doctor.
To hospital, yes.
For a variety of reasons. I think we can all admit it. You have to wheel me into the clinic in a wheelchair. And also to young people, because of the privacy offered in comparison to conventional testing centers and facilities. So as health being a devolved function, it is the different counties working with non-state actors and policymakers to see what can we do that fits my county. Because counties are different. They have different health requirements. You see, in the instance of Kiambu, it's TB. It is a very big thing, and I really applaud the leadership for waking up to it and also supporting not only PS Kenya and other non-state actors, but the National Tuberculosis, Leprosy and Lung Disease Program that handles it as well, and coming together and saying, okay, what can we do as a county, and what can you guys do as stakeholders to help us eradicate TB?
Okay, now, gentlemen, I know, Professor, you want to say something, but I'll give you 30 seconds because I really need to leave for the next show that's starting in a few minutes.
No, that's fine, and thank you so much. For me, is to make sure we have disease-specific programs.
Yes.
Like that one with Kiambu. For us, Mata, we do both HIV at our comprehensive care unit, and also we do the cardiac programs. And that's why every year we do the Matahatran. We raise a few hundred million shillings that goes towards helping all these children. And I want to encourage Kenyans to come out on the 25th of May here at KICC. We make sure that children who have cardiac problems are actually taken care of. But then at the same time, encourage our fellow brothers and sisters who are running hospitals and in either county or otherwise to make sure that we develop those disease-specific programs. Jimmy Carter said so many years ago that he will eliminate guinea worm. And guinea worm is almost extinct, is almost defeated because of that single focus. If we do that in a comprehensive manner, we should be able to defeat some of these diseases that are debilitating our people every single day.
All right. Now, gentlemen, we could have this conversation all morning, but I need to give room for the next show that's coming up. But Professor Dominic Mwanja, CEO, Mata Hospital, and Rujuma Program Manager, HIV and TB at PS Kenya. Thank you, gentlemen, for your time, even as we looked at UHC and how that is looking and what we should be prioritizing, making it a success in the country. Thank you for watching NTV Today.